welcome everyone to the Street Dog Podcast, brought to you by the Street Dog Coalition. We are an international nonprofit providing free medical care and related services to pets of people experiencing or at risk of homelessness. I am your host, Daria Tavana, and I'm also the Director of Development at the Street Dog Coalition. So on this podcast, for those of you who are new to our community, what we do is we explore the world of animal welfare through the eyes of experts, street dog vets, and volunteers, in addition to our partner organizations. And in this case today, our legacy sponsors. So if you're tuning in live on Facebook, it is great to have you here. Go ahead, drop an emoji in the comments. Let us know where you're tuning in from. Let us know what your favorite color is. What's the weather like where you're at today? Don't hesitate to ask a question if you feel inspired to. And if you're listening on Spotify or Apple Podcasts or YouTube, please make sure you're following the Street Dog Coalition on Facebook so you can also tune in live every episode. And that will allow you to engage with us in real time, which we love to do. Okay, so on today's episode, we have two very special guests. We have Dr. Robert Duquette and Dr. Tracey Rock. So a little bit about each of these guests. Dr. Robert Duquette is an experienced veterinarian and associate director of the West Zone for Merck Animal Health Veterinary Professional Services. With a PhD in veterinary physiology and a doctorate degree in veterinary medicine from the University of Liverpool, he has a strong academic background. He has also practiced companion animal medicine, surgery, and shelter medicine for 10 years in the UK and the US, including serving as the head veterinarian for a large municipal shelter in California. He is a published author, has presented his work at conferences, and is a member of several professional veterinary associations. Now, Dr. Tracey Rock is let's see if I can get this word correctly, a pharmacovigilance veterinarian for Merck Animal Health. Love it. She's giving me the thumbs up. And one of our Pittsburgh volunteers and original trailblazer for our Street Dog Coalition Pittsburgh team. She has received a Circle of Excellence Award, no big deal, from Merck Animal Health, based on her collaboration with the Street Dog Coalition and elevating Merck Animal Health's unconditional commitment to supporting the veterinary profession, as well as the animals and people that Merck Animal Health serves. So we are really humbled to work with Tracey and with Robert. And Tracey has also brought a lot of phenomenal people into our orbit as an organization. So without any further ado, welcome to the podcast, Robert and Tracey. Woo!
Thank you.
Thanks. Yeah.
Robert, I didn't know all that stuff about you. I'm humbled to just be talking with you. Physiology. Oh.
Yeah. Well, my PhD was supposed to be on GDV, and it was in the Department of Physiology. So
cool.
It's pretty cool. Robert, I'd be lying if I said that I knew all of that about you when I first met you at the AVMA conference. I learned all this about you whenever I was doing research for this podcast. And I was like, wow, really? Because if you know Robert, you know he's so humble, so familiar, so hilarious. But of course, you can be brilliant and hilarious at the same time. So at least I try to do that every day. Some days are better than others.
And I'm assuming your research, you went to the Merck Animal Health website for our PSV bios. Okay, I was gonna say, because I didn't give you anything, but
no, you gave me nothing.
That our bios, a plug for our website.
That's
it's a great
right.
place to meet our PSV team.
Yeah, it really is. It really is. No, you gave me nothing. And it's like, I'm always, every time I don't ask the individual for the bio and I do my research, as I'm saying it, I'm always like, God, I hope this is still accurate. So glad it is still accurate. And I'm really just so excited to have you guys here because, as you know, our executive director, Katrina Weschler, loves you both and our community really loves you both. And I'm just excited to ask you guys a few questions. So is it cool if I just dive in? How do you guys feel?
Sure. We love Katrina too, by the way.
Oh yeah, she's the best. She is the best.
She's very capable.
She is very capable. I love that word. Okay. So this question is for both of you guys. You're welcome to chime in, in whichever way feels most comfortable for you. So why don't you guys tell us a little bit about Merck Animal Health and maybe how your legacy sponsorship of the Street Dog Coalition came to be? And what does the sponsorship mean to both of you?
That's like a 4-part question.
It is a 4-part question. It is a 4-part question.
All right, I'll dive in there. I don't even remember the question, so I'll just start talking and see what happens.
Yeah, we just want to learn about Merck Animal Health, and a little bit about your legacy sponsorship of the Street Dog Coalition.
So, well, I think without Merck, I wouldn't have ever discovered Street Dog, because we send our people to continuing ed. And so one of my colleagues was at continuing ed and saw, I think it was actually the AVMA convention, and saw Dr. John Geller, founder of Street Dog, and then came back and reported it during one of our staff meetings. And I thought, oh, wow, that sounds really interesting. I should start digging into seeing if we have, a way to help the pets of the homeless here in Pittsburgh. And there really wasn't anything. And so I ended up becoming a part of Street Dog. And in the meantime, there were a few other people at Merck that had also been involved, including Robert, and a few others. And so at another meeting, Robert and I happened to be, Robert's on the West Coast, I'm on the East Coast, but we happened to be in the same place at the same time. So we were able to collaborate and discuss, getting Merck involved in Street Dog. So it really was very Merck driven as far as having the stars align.
I love that. And maybe, Robert, you can tell us a little bit more just about Merck. I mean, I know all about Merck, but if someone's listening and they don't know a lot about Merck, what are a few takeaways you'd like them to leave knowing?
Well, happy to. And I also, I don't want to correct Tracey's story, but I think she's underestimating or not giving herself credit. I don't think we would have had the relationship. In fact, I know we would not have had the relationship that we do in becoming a legacy sponsor without Tracey, without her pushing to get us involved. We have what we call our unconditional campaign, and this is Merck Animal Health's unconditional support of the veterinary community. And after that campaign was launched, Tracey came up with the idea, what a better fit for Merck to sponsor the mission of Street Dog Coalition with providing unconditional support to the pets of people who are at homeless or at risk of homelessness, because they're so critical to these individuals. And it was just such a wonderful fit. And to me, I still remember, Tracey, when you approached me about it. It was at Western Veterinary conference, wasn't it? Yeah.
In the heat of the day, we found like 10 minutes to try and work it out, get it done.
And it was the perfect fit. And as I don't know if you met Dr. Christine Royal, who now leads our whole companion animal and equine business unit. She was at that time my boss, and she was so supportive of it as well, and also agreed that it was a perfect fit for Merck's mission, as well as supporting the Street Dog Coalition with our unconditional campaign. And I like to say with unconditional, it's kind of like, because we all have pets. Our pets love us unconditionally. We want to provide that love, not the same way that a pet provides it to us, but it's the same idea to support the profession, vets, animals, pet owners, pet parents, however you'd like to refer to them alike. And again, all of this was made possible because of Tracey's
I love that
idea.
My cheerleading, we'll call it.
Well, yeah, your
persistence.
vision. I like vision. Yeah.
Yeah.
I love that. Tracey, I love the humility. Now is not a time to be humble, Tracey. Clearly, you've had a huge impact at Merck and at the Street Dog Coalition. And it sounds to me like like Merck's involvement with the Street Dog Coalition, like we've almost provided Merck with this opportunity to act in alignment with their values. So maybe Tracey, well, first of all, I want to congratulate you again for receiving the Circle of Excellence Award from Merck. And maybe you can kind of shine a light on this more. Maybe you can share with us how your collaboration with the Street Dog Coalition has helped to elevate Merck Animal Health's commitment to supporting the veterinary profession and the animals and the people that they serve.
Yeah, I think, Robert's right. It was a perfect fit, and it was at just the right time. As I said, the stars aligned. And what Merck does to back up is we manufacture and sell products for animals, all various species, many different species. And so Street Dog goes out and supplies a lot of times these products, and we had them, and Street Dog needed them. So it was just that simple. And so because the fit was so good, I was ecstatic actually that we were able to get the commitment from Merck to provide those products to Street Dog, which is a lot of what we, as a Street Dog person, that's a lot of what we needed. We needed our brains and we needed our feet to walk to the right places, but we needed the drugs, the vaccines, the flea and tick medication, just to simplify it, if we saw a skin condition or we saw an ear infection, these were all things that Merck could help us with. And so that to me just seemed like just the right place to go. It happened to work for them. And so that's where the whole thing landed. If that answers the question.
It does answer the question. It does answer the question. And I want to try to not make this entire episode me thanking you for providing that opportunity for us. But for those of you who are listening, I think a lot of our listeners have volunteered at our clinics before. A lot of them are team leads. A lot of these individuals are donors who have swung by a clinic or two. And I'm always impressed at how, frankly, well equipped we are. And it's quite a sight to see, because oftentimes we are in, parks. We are pulled up on the side of the road operating, on a folding table. Yet, despite how scrappy those efforts are, the equipment that we come to these street clinics with, that our volunteer team leads arrive with, as you mentioned, this tick prevention, these vaccinations, they are the best of the best. We always seem to have enough, and I just can't thank you enough, both of you, for essentially being the reason why we have that access, and being the reason why so many animals are able to get this kind of treatment in an environment that that they might not have access to any other way. So big thank you.
Exactly. And I think you have to bring Dr. Geller into this, because he sets us up with so as the team lead in Pittsburgh, when I first started the team here, I never forget when everything started showing up. So he provides you with everything that you need to get started. And believe me, it is comprehensive. And there were a lot of products, Merck products. So we're grateful for that, but there certainly was a lot of other products that were not Merck products, and and equipment, and you name it, he had it, to black Sharpies to garbage bags. He sent everything. And it is a feat for those people listening that are part of teams or run teams, to get that stuff back and forth from where you need it. My whole car was just organized and loaded and ready to go with my little Street Dog sign on the side. Robert can speak to that too, since he does still does clinics. But Dr. Geller really had it organized and down pat. So I enjoyed that part of the job. I was the inventory manager. That was my thing.
I love that. I love it when guests come on this podcast, and I'm telling you, like 50% of them say something like, I was listening to this presentation by Dr. Geller, or I was seeing Dr. Geller in action and I felt really inspired. So I'm sure he's listening, and hopefully he is uncomfortably blushing upon hearing this.
Yeah,
Um,
that's funny.
and
When
yeah,
he's getting ready to head off to the Ukraine,
he
I talked to
is.
him, maybe it was Friday or Thursday of the last week, and some of the, I mean, Street Dog just and Dr. Geller are amazing beyond belief with everything that you guys do. So
Thanks, Robert. Thank
it's
you.
the thanks to you guys.
Let's just spend the next 20 minutes thanking one another.
Okay.
Robert, I actually have a question for you. And when I say question for you, Robert, by all means, Tracey, please chime in. But I was thinking of Robert when I was thinking of this question. So as an experienced veterinarian with this background in shelter medicine, I'm curious to know, what are some of the unique challenges you've encountered while providing veterinary care to pets of people experiencing homelessness, and maybe even like to animals in shelters? Like what's the difference between these two groups? And what has your experience been like in providing care for both groups of animals?
Ooh, that's again a big question to begin with. um, the the first thing with people, who are experiencing homelessness or at risk of homelessness, they have so many things going on in their lives to begin with, but their pets are such an anchor for them and a support system. So my experience is they would do absolutely anything for their pet. Well, their pets come top priority. So I don't even know where my answer is now going, other than we want to provide the best care we can for them it's not a stressful environment, because we're not stressed when we're running these clinics, but in reality, it's not like we've got all the tools you have in a normal clinic.
Sure.
We can't say, oh, we've got to run a CBC cam on this person and do your analysis, send this one to radiographs. Those things are available for those pets, which Street Dog does provide extra funds if and when it's needed, but you're kind of doing things back in the way maybe when Tracey and I first graduated as veterinarians, where you didn't have all these extra tools to be able to do everything. And shelter medicine, I want to as well say, I am not a shelter medicine expert in no way whatsoever. We do have an expert on our team, Dr. Matt Getz, but my experience, at least with shelter medicine, is it's more of a herd health approach, because these animals don't have, they don't have an owner who can take care of them, and they're not getting the love and the attention that a pet who does have a pet parent, or I'm sorry, I don't know what the PC term is. I still call them owners, and I know I think we're not. A lot of people don't like to say pets are owned, but
Caretakers.
Yeah, caretakers. There's
There
a
we
good
go.
one, because when. So I don't really know how to answer that one. There are some incredible differences. I guess one of the things, and I don't want this to sound like I'm giving a plug, but one of the best fits with Merck's message for either a shelter or Street Dogs is convenience, and convenience with extended duration products like Bravecto that you don't have to remember to do every month, makes it a lot easier for everybody to provide that preventative care for their pet. And I, like I said, I wasn't even going to say anything like that, but
Plug away.
Okay,
Plug away. Educate the people, please, Robert. Don't hold back.
That's why it was such a good, one of the reasons why it was such a good fit, for what we focus on.
Yeah, I think the homeless population has an awful lot. And I felt like when we would meet individually with each person and their pet, I would be handing them things and telling them that this goes on this date and this goes on this date. And I felt like it was pretty overwhelming, just the fact that they had gotten there and gotten their problems resolved. And we're grateful that, that we had medication to provide, but still it was a lot. So I was always thankful that the Bravecto was only every 3 months for flea and tick. And, flea and tick was something that people was really on their mind, and certain, at least in the part of the country where I am, which is the Northeast. And I think we didn't get as many questions about heartworm disease, but fleas and ticks you can see. And so that was for the pet parents, that was concerning. And especially in the environments where a lot of these people were staying. So I agree with Robert. I appreciated the fact that we had something that we could hand them, that they didn't have to remember to give constantly. So that was, again, I agree. That was one of the good fits. That was one of the things that I enjoyed handing them and saying, oh, you don't have to do this for another 3 months. Like, oh,
I always
really?
love
That's
to hear
awesome.
that too.
Yeah.
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 So-
So that was good.
So it sounds like really the biggest distinction here, Robert, as you mentioned, of course, in shelters, we're dealing with, like you said, these herd circumstances and potential diseases and barriers to optimal health. But it's just interesting to hear the difference between the two, because it sounds to me like there is this human element that comes with helping pets of people experiencing homelessness. And that comes, just this idea of communicating a prognosis, communicating what these medicines do, how often you should take these medicines. And then, of course, trusting individuals will actually administer these medicines. And it's so funny because when I speak to veterinarians who volunteer with the Street Dog Coalition, they, of course, say, more often than not, I'm sure there are other circumstances, but these individuals take such good care of their pets. And oftentimes they do come back to street clinics. I've even seen on multiple occasions at our Philadelphia clinics, there are individuals who bring their pets to every clinic, even if their pet was just there, even if they were not even instructed to bring their pet back, because they just want a veterinarian to look at them. Because that relationship that they have with their animal is so strong and it means so much to them, and they would just rather be in the clear. So it's interesting to witness a lot of these individuals take such good care of their pets, oftentimes better than people who have homes and are at work all the time. Is that something you guys have experienced as well?
Yeah, I think so. I was surprised by that. And it's funny, you talk about the people end of all this, not to digress, but I totally got into it because it's all about the pets. And as a veterinarian that works for Merck, and I'm sure Robert can say the same thing, we don't practice medicine, so we don't get that feel good part of working with animals. So I was like, oh, I'm all in. This is awesome. I'm going to go out, I'm going to work with some pets. But, there's a whole other side to that. And that is that you also are working with the pet's parent. Yeah. And so it took me a while. There was a learning curve about learning to actually communicate with the pet parents and their idiosyncrasies and their desires and their concerns. And it's about 50% of the equation. So that was anybody who's going to go out there and start volunteering for Street Dog. That's, you got to be prepared for that. And you have to be, I was definitely on a learning curve there. You could tell that I hadn't been practicing for a long time, because I'm sure that's the way practice is as well. But I was like, oh gosh, now I actually have to talk to the human. So
the human, and there's so many interesting individuals that bring their pets to our clinics. I remember at AVMA, we were telling someone that they should bring their pet back after a certain period of time, and his response was a lecture in how time is an illusion. And it was just the most interesting, spaciest conversation I've ever had. We brought him back down to earth and then continued to relay the importance of actually bringing their pet back. But it was just, the people are so colorful and they love their animals. They just express that love and their opinions in so many unique ways.
And it can be incredibly rewarding. We initially, when we started our team in Pittsburgh, we were heading out to homeless camps or areas where we knew that there were people. I mean, we tried to have appointments set up, but we would get to places instead of people coming to us. And that was one of the models that we decided to try in Pittsburgh. And we were on our way somewhere, and we just happened to pass a guy that was sitting on the curb with his dog. I mean, looked homeless. And so the people that I was working with Allegheny Health Network, which is an organization that works with the homeless, pulled over. We stopped the van. He went and talked to, this guy's name was Freddie, and his dog was Tonka. And he said, yes, like he couldn't believe that we just dropped out of the sky. He had just gotten out of jail that day. He had just gotten his dog back from because they had to take the dog and place the dog in a shelter. And he was so grateful, but his dog had some issues going on, including a really bad skin infection. And here we were, a van full of veterinarians and vet techs just ready to dive in. And it was
awesome.
The neatest experience. And it was so fun just to get to know him and to talk to him about his story and to be able to help his dog, Tonka. And that stuck with me for a really long time. So was I a people person before that? Probably not, if you talk to people who know me, but I really became one when I was working with this group, this population of people. So it was really
cool.
it was a really neat experience, just the whole thing.
That's awesome. Robert, have you, I'd be hard pressed to believe, Robert, that you're not a people person, but is there an experience at a clinic or doing street medicine that really like sticks out to you, something super memorable that you could share with us?
Oh, I mean, there's so much that I always talk with what immediately comes to mind.
Yeah.
This is not really, there's so many examples of this, and it ties back into the street dog mission, people loving their pets, and they do everything they can for their pets, and they put that as their top priority. And the One Health approach that you guys take. And I've got so many wonderful memories of one of the clinics. My local clinic is actually really fortunate where they have, it's called Clinica Sierra Vista. And it's a human health component that is at every one of theirs. So some of these people, when they're getting their pets looked after, also need, sometimes they have a dentist, sometimes they've got, they always have doctors on hand, to get some of the help that they need, because they often don't have the best relationship with authority. And that is even though for these pet owners, because I know in my local clinic, so many of them are even terrified to bring their pet in, thinking animal control may be there and it's going to try and take their pet away. But it's just getting the opportunity to see somebody who loves to see their pet get the care it deserves, and then also see them get some of the help and support that they need, which Street Dog does so well in so many clinics. And I think after COVID, we all know that One Health is something we can't ignore. Veterinarians and human doctors, we all need to work together and identify and prevent disease, because so many of us have pets, and our pets are part of our family now. They're not sitting outside, they sleep in our beds, whether you're at risk or homeless or not, you're still spending a lot of very close contact with these animals. And so that's where my brain was going as far as specific examples. I mean, I could come up with many, but the biggest thing that really, it ties in with what Tracey said about people coming back. It's seeing these people whose pets have a litter of puppies or kittens and are back, first one in the line, after for the next clinic, to make sure they get vaccinated, to make sure they get their dewormers and provide the care, and then make sure that these pets get into these babies, their babies or their grandbabies, I guess you could call them, find really good homes and get to spend the time with them, and then see these babies get adopted, which we didn't often get to do when we were in practice. I mean, practice is so busy now for anybody who works in a clinic, and Street Dogs, it's so nice to get to talk to people, hear their stories, and get to know them, I would say, and their pets.
Agreed.
Even Tracey, formerly not a people person, is enjoying getting to know people.
I've been transformed.
I love that. And I'm sure most of the people listening to this episode are also not people. They are pet people. And that's why they're listening to this episode. So surely they can relate. Also, I am not, believe it or not, really a people person either. I'm a cat person. I would love to maybe wrap things up real quick with you guys by just kind of leaning into the previous thing that Robert just shared with us. So for those of you who are listening who aren't familiar with what the One Health model is, it essentially recognizes this interconnectedness of people and animals and communities. And I know we talked about how these street clinics that we host, in partnership with Merck at the Street Dog Coalition, how we are not only caring for pets of people experiencing homelessness by providing them with Merck's amazing medicine, and also connecting them with other resources like mental health resources, addiction specialists, barbers, dentists. But that third prong of One Health is, of course, the community, right? So I would love to maybe get a little bit of insight from you guys, just maybe like about what the impact, maybe in terms of what you've seen, or even maybe what you hope to see. What is the impact that this One Health approach to medicine, that taking care of pets and people, will have on the communities that the Street Dog Coalition exists within?
I think what I saw, if I'm understanding your question correctly,
Yeah.
what I appreciated when I first started the team in Pittsburgh, I first needed to find my resources. I wasn't going to just jump in my car, run out there and go meet a homeless person and say, hey, can I help take care of your pet? And so there was some really good groups of people that I got involved with, and one was Allegheny Health Network. But what I enjoyed is that they embraced the idea, because when you offer to help a person that doesn't necessarily want your help, but when you find a way by offering to help their pet, you bring them in, they can embrace the idea, because you are offering a service that they feel is valuable. And that in turn allowed them to accept help for themselves, which helps the community, because as we are able to help people become no longer homeless, to become housed, to get medical care, there's all kinds of benefit to the community. And that's how I see One Health, at least part of it. So by us actually providing a service, we were helping, by the ripple effect, way more than I think I probably realized in the beginning.
Wow.
And so that, I think, was a really neat experience once I kind of step back and look at, how this was all coming together, how it all connected, so to speak.
Oh, I love that. I love that. And Robert, have you had similar feelings and experiences as Tracey about the community impact?
Oh, absolutely. And it is every worst. I don't want to get into politics, but the U.S. sometimes we have so many polarizing views, but I think this is something where we do still all live in communities. And I think at the local level, it's not as polarizing as, it gets on the state and the national, the higher you go up. And Street Dogs takes this bottom-up approach, which I love as well, to provide solutions to help the communities where these clinics are going on. And yeah, it just provides a way for people start communicating more. And like what Stacey said, with the different resources, seeing somebody who is really reluctant to get help for themselves, but wants their dog or their cat to get this, and they'll bend over backwards to do that, and just providing the way to build a rapport with these individuals to help them get what they need. And, to help, not everybody, I don't want to say the homeless situation is multifactorial, and we're not here to provide a solution to that, but we're here to make and support these people who are struggling right now with a variety of things, and to get them the services that they need, as well as provide their pets with what they need as well. And I'm waffling on now, I think so.
I love it. I'm right there with you. That's amazing. And I couldn't agree more, Robert. I think I really, what you're both saying really resonates with me, as I'm sure it will resonate with a lot of our listeners. And just to kind of layer into that, I think, Yes, of course. Once we are able to allow people who are experiencing homelessness the opportunity to take care of their pets live longer, healthier lives, and they're able to kind of lean into that relationship more. They're able to be inspired by their animal to maybe take a different approach to their own health. I know I've heard, we've spoken with people that have had direct experience, that have lived on the street, and they talk about all the time. We hear how it was my dog that inspired me to to explore different circumstances, to explore different options. Now, I'm saying that as if it's so easy to do, and of course that's not easy to do, but I do think that oftentimes these relationships with these animals allow certain individuals who are experiencing homelessness to maybe shift their perspective just a little bit. And I also see how these clinics have transformed the lives of the volunteers who are volunteering at these clinics. Even people who walk by these clinics are like touched and didn't know these services existed, and get excited by them, and kind of pay it forward in their own lives. So to just tie in everything you're saying, I really feel like what the Street Dog Coalition does and what Merck allows us to do by being a legacy sponsor is just create, I'm going to sound like a real big hippie here, but just create just a more compassionate world, right? Create communities that value animals, value their health, value people who are experiencing homelessness, view them a little bit differently, view their relationship with their animals differently. And yeah, now I'm waffling on and on. But it's a beautiful thing. It's a really beautiful thing. And
it is. And, I
yeah.
do need to add in, as far as, and we kind of started by talking about Merck and how a lot of this was very Merck driven, just by, giving us the time to do this and that. But what I failed to mention is that Merck also, for all the employees, gives us 40 hours of paid volunteer time a year. I don't know any other company that does that. Maybe there are. But it certainly does provide every employee with the absolute easiest opportunity to go out and work in the community in various and sundry ways. And I always was really proud, actually, to be an Merck employee because of that, because that's how committed they are. They will give you 40 hours of paid time to go out and help.
Amazing.
I mean, how can you turn that down? So yeah, it's, it's a very committed company, and I much appreciate that. I think that because of that, and because we were able to start Street Dog in the various places that we've started at, Robert and I, and we have other people that at Merck that also work with Street Dog, that it just really helps as far as building that trust with the person through their pet.
I love that. And thank you, Tracey, for shining a light on that. And before I let you guys go, is there anything that you want our listeners to know about Merck? Do you guys have an initiative that's coming up that you'd like to loop people into? Robert, now's your chance to plug something.
I'm not going to plug anything. Tracey, I'll let you start. I'm thinking
I can't think of any initiatives that are coming up that we would actually be allowed to share.
Ooh, okay.
Secrets, yeah.
But
stay tuned. How's that?
Stay tuned. Yeah, I love that.
That's a good way to put it. Yeah.
You guys, you go ahead, Robert. What were you going to say?
No, I was going to say I can't think of anything either. But getting
Robert,
involved with the Street Dog Coalition is I highly recommend it. It's just so fulfilling for everybody on multiple levels, and being able to give back to your own community in a way that is going to make a difference for where you live and the people you live around and with. It's an amazing feeling.
Thank you, Robert. I appreciate that. And for those who are listening, who are interested in volunteering with the Street Dog Coalition, or making a contribution, or making a donation, I'll include all the relevant links in the show notes of this episode. And please, by all means, go to Merck's website, follow Merck on all social media channels. Stay tuned, because we never know what's going to come up with Merck. Robert, the man with the answers, cannot reveal anything just yet. I'm really creating unnecessary hype.
Oh, you never know. Never know.
Yeah.
Oh, yeah,
Always
but
good stuff to come.
always good stuff to come. And Tracey, Robert, I want to thank you so much for taking the time to chat with us today. I know that people who are listening have been hearing for a long time now how much we love Merck, what this partnership means to us, how Merck has enabled us to make this huge impact on a national level and now like a global level. So from the bottom of my heart and on behalf of everyone at the Street Dog Coalition, thank you both so much for this just incredible opportunity to help pets of people experiencing homelessness.
You're welcome.
Yep.
Thanks for having us.
Thank you.
Absolutely.
Thank you both. And thanks to everyone who tuned in. Until next time.